Well, good morning. Dr. Davila and I are very pleased to be able to update you this morning with respect to vaccine-related matters and to COVID-19 related matters. And we continue as a city to make every effort we possibly can to get everybody vaccinated. As of the moment, almost 79% of eligible residents are now fully vaccinated, and more than 84% have had at least their first dose. That is a considerable accomplishment, thus far exceeded by few. But we remain focused on reaching the target of having 90% of eligible residents vaccinated, and we know this will take a patient, dogged, data-driven, targeted approach, and that's exactly what we're implementing, and we're going to tell you more about that today. As I said last week, we have administered millions of doses. To put this all in perspective, millions of doses of vaccine, and now we're focused on administering the last numbers of thousands of vaccines. We have more than 2 million people vaccinated in Toronto, meaning that we have about 314,000 people left to go to get to the 90%. 158,000 of that 314,000 already have their first dose and just need a second dose. And when I say just, there is work for us to be doing in this regard, but they have taken the step of having the first dose administered, and now we're working through those people to get them to the second dose. We have vaccination clinics up and running every day in our city. So far this week, 58 vaccination clinics have been held across the city, including on-site and pop-ups and mobile clinics. 23 clinics, for example, are operating today across the city of Toronto. But along with this daily work, we're trying to have and to fashion major pushes to get people vaccinated, to drive up the vaccination rates, and also to draw some attention to the fact that there's plenty of opportunity to get vaccinated on an accessible basis. That is why, starting tomorrow, we are launching what we're calling the Days of Vaxtion. The Days of Vaxtion will be a major push to get people vaccinated and will run from tomorrow, Thursday, September 16th, to Sunday, September 19th. We're working with our Team Toronto partners again to have a series of targeted vaccination clinics across the city over these 4 days. This is a mega event made up of a series of micro clinics. As opposed to what we did at Scotiabank Arena, which was one very large event, now the targeted nature of the work we have to do has us setting up smaller pop-up clinics put exactly where we know people need to get vaccinated and where we know people will be over the coming days on this question of accessibility. The city has partnered with Toronto Public Health, the TTC, Humber River Hospital, Michael Garron Hospital, North York General Hospital, Unity Health, Black Creek Humber Summit, Sherbourne Health, and other community partners to hold mobile clinics so as to make it as easy as possible for residents to get their first or their second dose of vaccine. And I want to say at this juncture, thank you to those health partners, because they have been easy to work with throughout. We have accomplished a lot throughout. We've got those numbers on the board today because we've all worked together, and we continue to work together on this Days of Vaxtion that we're going to be having over the next few days. The mobile clinics will be operating between Thursday and Sunday, including clinics in TTC stations, parks, and schools. There's a very complete list that will be forthcoming to you, but it's a very impressive and spread right across the city range of options for people to take advantage of in order to get vaccinated. It includes 3 mobile clinics which will pop up along Yonge Street, clinics at Trinity Bellwoods Park, public schools, and at the Shepherd, Islington, and Warden subway stations during the Days of Vaxtion period. I also want to recognize the Scarborough Health Team, who will be operating 8 mobile clinics on Saturday alone, including at 4 malls, the Golden Mile Mall, the Bridlewood Mall, the Parkway Mall, and Cedarbrae Mall. And Dr. de Villa and I have both had the opportunity in another mall, the Albion Mall in the Northwest End, to see the degree to which people just out to do a little bit of shopping or even out for a walk in one of those malls will stop by and get themselves vaccinated. And that's a part of what we want to achieve in all of these places, including the subway stations. We are working with our Team Toronto partners to have more clinics as well, but I should say the sites that we have chosen in conjunction with them are part of the mobile strategy data-driven approach to continue to remove barriers and bring vaccines to residents and to areas and settings that have low vaccination coverage based on all the records that we have, or people who are at high risk of infection, or both. So that we're looking at those two things, the rates of infection in different areas, the rates of vaccination, and putting all that together and making decisions on where to have these clinics. These clinics were also chosen to have locations that are easily accessible to the everyday lives of Torontonians, especially in these areas with higher rates of infection and with lower rates of vaccination. We know that when we make it incredibly easy for people to get vaccinated, they will get vaccinated. The overriding message continues to be, please get vaccinated. If you need your first or second dose, I strongly encourage you, we all strongly encourage you to get vaccinated in the next few days. As recently as yesterday, I spoke with some residents in a mobile clinic getting their first doses, and they just needed a bit of a push. They just needed a bit of reassurance, and that got them to the mobile clinic. And I think that was combined with the accessibility of this clinic located up in a parking lot in Little Jamaica, where we were having another kind of event to celebrate the reopening of the city. We can do that for people like them, to make the clinics accessible, to provide the reassurance, to provide the comfort, to provide the information. And by we, I don't just mean people in government or people at Toronto Public Health or our healthcare partners. We can all do this together. We can all convey the reassurance of the fact that we are vaccinated, we have been through it, and that we can refer them to some of the readings that they might do of reliable sources of information. It is not worth waiting any longer. The fourth wave is here. The Delta variant is here. They're very much here, but the vaccines are here too. The vaccines have been with us for some time now, and it's why we have had some success and made some progress that we want to protect. Vaccines are safe. They're effective. The COVID-19 vaccines continue to be the best way in which you can protect yourself, your family, your coworkers, everybody you associate with from this virus. And they're the best way to avoid, as far as possible, ending up in the hospital or worse, dying from COVID-19, which people, I regret to say, in our province continue to do, albeit in smaller numbers. But the best way to stay away from that fate befalling you at all or ending up in the hospital at all is getting vaccinated. We want as many people to be protected from this terrible virus as possible, and I know the more people who are vaccinated, the safer our entire city will be and the more progress we'll be able to make. And I'll just finish on that optimistic note. It has been so heartening to see that people are going back to work, to see that people are out enjoying themselves to a greater extent, to see the sidewalks that have some action in the different neighborhoods, supporting our shops and our restaurants and supporting our small businesses and just being with each other. That is so heartening to see kids back at school and all the people going back and forth to the schools along the sidewalks, as I've had the chance to see. We want to keep that going. We want to keep that moving forward, and vaccinations are the key. Thus, our efforts on Days of Action for this weekend, plenty of opportunities right across the city in every venue you could possibly imagine. And frankly, if we haven't thought of any you think are a good idea, please let me know. So on that note, I will ask Dr. Davila, who continues to do an extraordinary job for us, to say a few words about where we stand from her perspective.
Thank you, Mayor Tory, and good morning, everyone. My message to you this morning is so simple and so important. There is not much more to say other than get vaccinated if you haven't been. Vaccination is absolutely essential to making it harder for Delta to spread and for doing our part to prevent mutations that could lead to variants of concern. Right now, our biggest concern are the new cases of COVID-19 that are emerging steadily in schools. This is expected, given the transmissibility of Delta and the population of students under 12 who, because of their age, can't yet be vaccinated. While it is most likely that COVID-19 will be a mild illness in a school-aged child or in a young person, we know that more severe outcomes do occur in some, and that our understanding of long COVID is still evolving. As such, COVID-19 is still best avoided in the first place. So please, get vaccinated if you're not already vaccinated. I cannot say it enough, and you will hear it from me again and again until we have reached a level of vaccination that reduces risk as much as we can. I cannot stress enough what a positive change vaccination will be for you. Feeling the confidence you will feel with less risk from COVID-19. Something you probably haven't felt very often in the last 18 months. Vaccination is safe, it's effective, it's protective, and millions of Canadians have completed their vaccinations and gone on with everyday life in good health, with the benefit of protection from COVID-19 and increased peace of mind and confidence as they go about their everyday life. With that, I'll now turn it over to Lavin for the question period.
Thank you, Dr. Davila and Mayor Tory. We will now open up the floor to questions. As a reminder, it's one question, one follow-up, and we will unmute you when it's your turn. So first up, we have Chris Glover from CBC. Go ahead, Chris.
Hi, sorry, can you hear me?
Go ahead. Go ahead.
I'm listening.
Okay, great. So around 50 schools in Toronto have at least one confirmed case of COVID-19, and if case numbers don't drop and more people don't get vaccinated, do you think closing schools is on the horizon? And if so, Dr. de Villa, at what point would that happen in Toronto? Or would you suggest that to happen?
So Chris, an excellent question, and certainly we are watching our school situation very carefully. Certainly when it comes to safety within the context of schools, there is a provincial framework and guidance, and we're operating under that guidance in concert with our school board partners. So I can assure you that there are a number of activities that are ongoing. There are investigations that happen, and some, lead to further investigations and more cases, and others, in fact, wrap up without further incident. So I can't speak to what will happen in each and every circumstance other than to say that the situation needs to be assessed on the ground, and decisions need to be taken in context of the information that comes forward from the investigation. But broadly, what we can all do to ensure as safe, an environment as is possible. We are in the midst of a pandemic with a very transmissible Delta variant, out and about in our community. And what we can all do to help keep our schools operating as safely as possible is to ensure that all of us who are currently eligible to receive vaccination are actually taking advantage of that vaccine, and that to the extent that we can, we are using all the public health measures that we know reduce the likelihood of transmission. The less we see transmission within our community writ large, the lower the risk of transmission within the schools, and the more likely they can continue to operate in as safe a fashion as is possible, given that we are in the midst of a pandemic.
And this next one is for both Dr. de Villa and also Mayor Tory. I understand that there's this 90% target that you're hoping for. I'm just wondering, is there a timeline that you guys have set to hit that 90%? We obviously know that Delta is a very scary variant, that a lot of people want to see the vaccine hit that 90% target as quickly as possible. But I'm curious if you have a timeline specifically, and how you think the ongoing protests at places like hospitals with anti-vaxxers is impacting your ability to hit that target.
So Chris, why don't I start off and then I'll turn it over to the mayor. Clearly, we would like to hit targets and see as many people as possible. We want to drive vaccination coverage as high as we possibly can, as quickly as we can. We recognize, though, that we are at a stage in our vaccination campaign where it does take a little bit more time, hence a very hyper-local, very focused vaccination efforts, considering, where the cases are, where risks are highest, and where vaccination coverage could stand the greatest improvement. That's what's driving our current efforts at this point in time. I would emphasize, as the mayor mentioned in his remarks, we've had millions and millions of people come forward, roll up their sleeves, and do the right thing to protect themselves and their community. And we're now, at the stage where we have thousands more to go. So I would just encourage people as much as possible, if you're not one of those who's already rolled up your sleeve, please do so. Get the information that you need from a reliable source to help move you in that direction, because it is truly safe, effective, and the best thing that we can all do together in order to protect our community and to get us to the other side of this pandemic. I'll hand it over to the Mayor and see if he's got further comments on this.
I'll just say that I think we're doing all the things, and that the combination of circumstances is going to help us to achieve that goal, and the objective should be as soon as possible without trying to put any timeframes on it. I think the evidence that in the case of Toronto, for example, during the May to August period, that almost 100%, just shy of 100% of people who ended up in the hospital were people who were not fully vaccinated. I think that is having an impact on people. I think the efforts we're making to make these clinics very mobile and very accessible right across the city in a very targeted way is going to help us to move forward to that goal. And I think, frankly, the implementation deadlines for some of the policies, where people know in their place of work, on a policy set by their employer, or in things they like to do, whether it's to go to sports events or concerts or whatever, that there are going to be requirements in that regard. And I welcome the fact those requirements have been put in place, because I think that too will cause people, I know from them telling me that that has helped some people to decide to get vaccinated. So all of those things will help us to achieve all of this as soon as we can. But I used the word dogged. It is one of those things where it's painstaking work, because it is more targeted now, and you're having to view success as being smaller groups of people than on a day when we could, for example, even think about getting 25,000 people to one place at one time. It's just different kind of work, but I think any kind of a campaign to do anything goes that way. The earlier parts are sometimes easier, and it gets a little tougher as you go on, but I'm very optimistic we can get it done, because it's the right thing for people to do.
Thank you, Chris. Next up, we have Matt Bingley from Global. Go ahead, Matt.
Hi, good morning, Mayor Tory. I'm just wondering, with the incoming vaccination certificate next week, do you have any concerns with enforcement? Do you feel that city bylaw is adequately staffed to take on what is coming?
Well, first of all, I should say that our city officials are still in the process of reviewing the regulations that were underlying the announcements of yesterday to understand what the implications are. But on the question specifically of enforcement, I'll say this. You know, when we look at people even adhering to something, I'll call it less serious than a policy that says, no shirt, no shoes, no service, you see widespread compliance with that. And it's not about something even as important, anywhere near as important as a huge public health emergency that we have. And so I'm actually very optimistic that most people, as they have done so far, will use common sense to follow the process, will want to have the vaccination proof in their phones or in their hands, and that it will be a very peaceful, orderly affair for people to show that proof and to be able to go about their business as they want. Let's remember, the vast majority of people in Toronto already have a vaccination, and so for them it's not an issue. And so I think that we'll have to take account of what may happen with the others, but I think I have every reason to believe that this will and can go fairly smoothly, and we will see what the regulations say precisely. We will obviously have our enforcement people adopt a strategy that can work, but I think that I'm optimistic it can go well.
Just on that optimism, though, based on the protests that Chris was mentioning earlier, and what we've already seen at certain businesses and other places when it comes to mask mandates and non-compliance and people with flaring tempers, do you think that's really that grounded? And just to follow up on that, with the 911 being told to be called for people in distress if there are any disputes, do you have concerns about emergency services being tied up?
Again, I continue to be an optimist and think the number of instances in which 911 will end up getting called, because I think, to be clear on what the minister was suggesting yesterday, is if there's some kind of a threat or intimidation going on, as opposed to a peaceful protest, that's when you should call 911. And anytime there's a threat to anybody's safety, that's when you do use 911. I think those calls will be relatively few and far between. I look at the protests that happened earlier this week, and again, I've supported all the way through the right for people to protest anything they want. But I look at the fact that in a city of 3 million people, where that very same day we administered thousands upon thousands of vaccines, a handful of people, relatively speaking, showed up. I think, even people who have a problem with this, and I understand their right to have those problems. I think a lot of it's based on misinformation. But I think even those people have come to realize that the kind of protest that involves intimidation at hospitals and with healthcare workers, or intimidation at a restaurant, just the whole notion of intimidating and acting in an intimidating, aggressive manner towards others in the process of trying to express your view is just not on, and that it's not going to be received well. And so I actually think that there won't be as much of that as people might want to think possible based on some very isolated incidents that have happened. And I think as a result, it will make the enforcement task, slightly less burdensome than you might speculate. But we'll see. And I can only say that if it turns out that I'm wrong about that and that there's more intimidation and aggressiveness and behavior that goes over the line, I'm sure that between all the different resources we have, they can make sure people are kept safe and that order is maintained.
Thank you, Matt. Next up, we have Mark McAllister from City News. Go ahead, Mark.
Good morning. I just wanted to clarify this latest campaign. It seems weeks and weeks and weeks now, we've talked about hyper-local approach to trying to get people vaccinated, but I'm not 100% sure as to what makes this different aside from a catchy title over a few days.
Mark, I don't, for a second want anybody to discount the fact that if you have a bit of a title and try to attract a bit of attention, we're in the awareness-raising business as well, because there are people, believe it or not, and I think we all understand, there are some people who focus more of their attention on these kinds of things like getting vaccinated than others. There are some people who, by way of how they receive news, just don't, get the news or don't get communicated with as easily, and that's not their fault. So some of it is admittedly about making sure that we're kind of raising awareness. But I will say, if you count up both the number of clinics and events that are happening on these 3 days, and if you, or 4 days, I'm sorry, and if you look at the variety of what we're doing, subway stations, malls, schools, parks, right on the street, like right on the street of Yonge Street, the main street of the city, we are, I think, embarked on an effort for those days that will have accessibility carried to a new level, but done in a very targeted way. Because we're not choosing these locations by accident or just trying to spread it out across the city. We very carefully targeted. So I think it's more locations in more different places over a period in a very concentrated way of 4 days based on very targeted information. And we're hoping that that will raise some awareness. Yes, we've called it a mega event in micro installments, and I think that's just how we have to do this, and we just got to keep at it. It's painstaking work, and we're very dogged and determined about it.
Chris had also asked you about timelines. I'm just curious about resource as well. As this continues to go on, perhaps these numbers continue to get lower and lower day by day in terms of getting people vaccinated. Beyond just the timeline, how long do you continue to throw resources at these sorts of things before you decide, okay, we've reached our limit?
What is it worth to save a life? And we spend a lot of money in the city on a lot of different things to do with safety of all kinds to make sure we save lives and keep people from being sick or injured. And so in this case, we're going to continue to invest resources. We're doing it carefully. We've shown no hesitation whatsoever about changing the nature of the investment. So we went from the mass immunization or vaccination clinics to this more micro approach, targeted approach. And we will continue to evolve the efforts as we need to do so. What's the cost to the economy of having another lockdown? What's the cost to kids of having schools locked down? So to me, it isn't a matter, I mean, we're not spending any money unwisely, but it's not a matter of saying, well, we should either give up or stop spending money, because what we're trying to do here is protect people. We're trying to advance the collective health of the city and protect it against a terrible threat that we've seen has taken an awful toll here and elsewhere. And so we'll continue to be very prudent about how we do this and careful about deploying the money properly, but there's going to be no, backing down just because it's a slower process now. We're going to, in fact, if anything, I think we should be increasing our efforts, but right now, I think we've got the resources we need, and we just have to make sure we're trying to do these things in the right way.
Thank you. Next up, we have Jennifer Pagliaro from The Star. Go ahead, Jennifer.
Good morning, everyone. The first question, I think, probably is for Dr. de Villa, but Meritori, if you want to answer as well. I'm curious about the process for picking the locations you have, and specifically that number you talked about, Meritori, of the number of people who are not yet fully vaccinated but haven't actually started the process at all. If we have any information about those people, do we know if they are specifically, for example, just hesitant, anti-vax, any demographics? I'm wondering if public health has done any sort of deep dive to understand the challenge ahead? That is this just still an access issue, or are we dealing with more hesitant people?
I will give you the non-scientific, non-medical answer to those questions, and then Dr. de Villa can answer more precisely. We have been picking the locations for the mobile clinics and all the different things we've been trying, including subway stations, all of which have met with a degree of success, but it's all done based on the data that we have about areas in which there are substantially lower vaccination rates and significantly higher risk of infection. And so it's all been data-driven, as you would expect that it should be. I asked the very question the other day about the ones that are in, I call it the gap, of people who have obviously stepped over the line that they had to, be satisfied to step over to get vaccinated with a first dose and haven't yet had the second dose. And we've had a very, very aggressive campaign going on. By aggressive, I mean we're using every means of communication possible because we know exactly who those people are. And there's a variety of reasons which Dr. de Villa can perhaps outline in some detail about why. Very few of them are anti-vax people only because they've already, crossed the hurdle of getting vaccinated the first time. But we're obviously concentrating on that group without overdoing it, because you have to be careful with people when you're trying to persuade them to do something. Like any of us being persuaded to do anything, there can come a point where you don't want to hear any more about it, but we're just working away at it in a very thoughtful way and based on the information they're getting back, which Dr. de Villa might share with you.
Thanks, Mr. Mayor. You've addressed a number of the points, I think, already. So, Jen, very briefly, as the Mayor indicated, when it comes to choosing locations for a hyper-local clinic or a focused clinic in a neighborhood, absolutely what we're looking at are data like vaccination coverage rates. And then as well, we are looking at infection rates in a given geography, as well as hospitalization risks. So we're looking at outcomes, infections, and vaccination coverage rates. These are amongst the key indicators that help us determine how best to situate mobile clinic efforts in that very hyper-local way. I think the other important component to our hyper-local approach to vaccination at this point in the campaign is the use of our community ambassadors. Local providers within the community, trusted providers, and people who are known in the community, who understand the circumstances, who understand where people gather, who understand what the mindset is and where challenges have been in the past, particularly with healthcare interventions, so that we're not only informed by the data, but as well informed by the specific circumstances and a deep understanding of that which the community has experienced in the past and what their beliefs are. So I think it's this combination of information that helps to provide us with a good approach, an approach that's likely to give us the kind of success that we need in this very last part of the vaccination campaign, which we know is going to be more challenging. With respect to vaccine hesitancy, there's no question. There is a certain amount of vaccine hesitancy that has existed before the pandemic and continues to persist through the pandemic. However, we have surveyed our population to, again, help inform our efforts to ensure that we're providing and getting that protective benefit of vaccine to as many people as possible, as quickly as possible. So we know that it's roughly about 5 or 6% of the population that identifies as what I would call as vaccine resistant. But roughly 15% of the population that's vaccine hesitant, which includes that resistant population. What's interesting, though, is that over the course of the last several months, we have seen a decrease in the proportion of the population that describes themselves as vaccine hesitant, which I think is a good sign. It speaks to the efforts that we have put out there to inform the public, to make sure that they've got the information they need to make the best decisions, particularly knowing what we know about vaccines, which is that they're safe, they're effective, and they're frankly one of the best tools we have in our toolkit to help get us to the other side of this pandemic.
And so just to follow up on that, Dr. de Villa, those are helpful numbers. So would you say then that in terms of a clinic push like the one you're about to embark on, is that really targeted at this shrinking I guess 10%, like I suppose you're not necessarily always going to be able to get that 5 to 6% you say is actually resistant. But you're really focusing on that 10%. Is that enough to get us to our goal in time to not have to be locked down this fall and winter?
Yeah, so Jen, what I would say is this, that absolutely we know that we have that opportunity, and we've already capitalized on the opportunity to address the needs of those who describe themselves as vaccine hesitant. But, I think that there is always opportunity for conversation, even amongst those who describe themselves as vaccine resistant. That's certainly what the evidence has shown. It sometimes takes more conversation and more time. But to my mind, it's important that we keep the doors open, that we keep conversation going, so that we can actually have a deeper understanding of, what is underpinning any resistance, if there is some, and what we might actually be able to do in a way that resonates with those populations to help address their concerns and their issues in respect of vaccine. So certainly we are going to focus on those who are perhaps just more hesitant and perhaps more quickly convinced of the benefits of vaccine. But, as a physician and a physician for the entire city, I think it's important that we keep the doors open for everybody and that we have conversations and keep open lines of communication, regardless of what your pre-existing perspective is on vaccine.
Thank you. Next up, we have John Chidley-Hill from the Canadian Press. Go ahead.
Good morning, everyone. My first question is for Dr. de Villa and Mayor Tory. If this new plan, this new the Days of Vaxtion you're announcing today, if they don't work getting the city up to 90% vaccination rate, what would be the next step? What's plan B, or perhaps at this point, plan D?
So perhaps I'll start off and say that I don't think that there is, any thought that in the next few days that we are going to be able to, that we're going to max out our capacity for vaccination coverage. As you've heard the mayor say, and you've heard me echo, we are going to continue to try to drive vaccination coverage as high as we possibly can, because we know that that's fundamental to reducing risk to the greatest extent possible. And as we have throughout the entire course of the pandemic, we use our data and we use, both, the numbers and the coverage rates and infection rates and hospitalization data, along with, more qualitative information from our community to help inform our efforts when it comes to our vaccination campaign. And as we have throughout the course of the entire pandemic, if we find that the results are not as we had hoped, or that there are other opportunities to get better outcomes, we'll absolutely change our course of action in concert with what the data suggest is best in order to get that vaccination coverage as high as we can. So that's the undertaking I can put out to all residents of the city, is that we are using all sources of data to help inform our action, and that's consistent with just good medical practice and good public health practice. I'll turn it over to the mayor for his comments.
I can't really add much except to say this. We have been monitoring this constantly through the period, as we did with testing, by the way, in the earlier stages, and to see what gets people out, what gets them to get vaccinated. And what we're doing is a reflection of what we've seen works. But we have to adjust our expectations, and I say that respectfully to the media, to the public, and to us. We have done so because now, in this kind of micro-targeted approach, you are achieving, slow but steady progress. It is slower. There is no question about that, because once you get to the point where you've got, close to 80% of the public fully vaccinated, it is going to be a more painstaking process. But we're watching it every day. We're watching the numbers as to how we succeed. We're looking at the things that work better than others, and we'll continue to fine-tune this and do whatever we have to do to get to those numbers. And I think if you look at the fact we've achieved, results so far that are, very respectable, at least globally, then for big cities, we will continue to apply the same, knowledge and data analysis and other things, a bit of imagination. And yes, to address the question previously raised, we have to do awareness raising, because there are still people out there who haven't, totally sort of signed on to the program in terms of knowing, let alone having an opinion, knowing about the vaccination campaign and the way they need to. So we'll do all of that, and I just think we'll just keep at it until we get there.
Thanks. My follow-up question is for you, Mayor Tory. This report just came out this morning, but Ontario's Financial Accountability Office says the province didn't spend any money from a new $2.7 billion COVID-19 response program in the first quarter of this year. We don't know yet, or the FAO doesn't know where that money was earmarked for, how it would have been distributed, but I have to imagine $2.7 billion. Some of that would have come to the city of Toronto in some way to help with its COVID-19 response. How frustrating is it from your perspective that that money went nowhere and was not put towards not just Toronto's COVID-19 response, but the province's response?
I'm not going to be critical today because I'm not familiar with what the terms of reference were for that precise fund when it was set up. I will say this. When it has come time, either on a cost-shared basis as between all three governments or any combination of governments, when we have approached the province for help, they've been there to help us. There are amounts they haven't yet actually paid out, although they've committed to do so. For example, they're going to underwrite the costs of the vaccination campaign. And if you think about it, that's a very substantial cost, but they haven't sent the money yet. So it could well be that the fact that, say, money is sitting in a fund like that is some of the money that's earmarked for commitments they have made to us to underwrite some of those costs. But I will just say, because one complaint I won't have when this is all said and done, I mean, at least up to date, is that the other governments have not been responsive when we've needed help on a variety of fronts, whether it's the money needed to underwrite the transit revenue losses or the cost of running the public health campaigns on different things, including vaccination. So I just, without knowing the terms of reference of that particular fund, I can't comment on why that money hasn't actually been paid out, but I expect some of it is timing, and that, in fact, when all the bills are put in, as it were, that money will be expended, but they have not been hesitant to support us, and there's more to come, I mean, because we're still at this effort, so I'm not suggesting that we will be stopping to ask them for help with these things, but it's been a good team effort so far, and we've all worked very well together, federal, provincial, and city, and I just hope that continues, and I hope that continues especially after the election, because an election, by definition, whatever the result is, creates a degree of instability just because people are getting used to whatever the new realities are. And so I just hope it just continues because it's been very good. The partnership has worked very well.
Thank you. Thank you, John. Next up, we have Momin Qureshi from 680. Go ahead, Momin.
Good morning. Thank you for taking my question. This one is for Mayor Tory. Mayor Tory, I talked to some small business owners last week about the vaccine certificates, and one of the main concerns that one of the business owners was saying, giving to me, is that he is concerned about the burden that will fall on his front staff, the staff at the front of his building, administrative staff, who normally just do administrative stuff, that they now will have to do some sort of enforcement or check, and he was basically saying that this is not something that they're trained for or should really even be their responsibility. So what do you say to small business owners like him? I understand this is a provincial policy, but what do you say to small business owners like him who feel that after being hit so hard in this pandemic over the last 18 months, this is now an extra burden that they have to shoulder that they don't think they should have to, and they're kind of stressed out about it?
I understand the stress. I understand the experience, terrible experience they've been through during the pandemic. What this is meant to do is to make it safe for people to go back into those stores and to give business to those stores. And I believe that it is going to be possible on a fairly straightforward basis for people, just as they do now often ask for you to show something or give something. I mean, it's going to be not really much different than giving your credit card, in that they'll ask you to either show a piece of paper or later on hold up your phone. I've been through it at a couple of larger venues, admittedly not small businesses, but I went to TIFF, for example, and they asked me to show a proof of vaccination, and I showed it the whole thing took 10 seconds. They asked me to show it, I showed it, they looked at it, and I went on. So I'm not minimizing the fact for a smaller business they have to do something they haven't been doing before, but I think when asked if you followed up in the very same questions and said, well, would you prefer having to develop some kind of a policy and procedure to keep people safe by asking for proof of vaccination compared to another lockdown? Or would you prefer that people coming into your store feel safe because they know everybody else in there has been fully vaccinated because of that brief check of something that should be fairly straightforward when it's available? I think most people would say, we'd rather things just got back to normal. We didn't have to do any of this, no masks, no distancing, no limits, no proof of vaccination, but we're not there yet. We can get there if we do this. It's just one more, period of a more modest dislocation, way better than a lockdown.
Just as a follow-up, sir, to that point, the person I spoke to owns a fitness center slash kind of physiotherapy place. So he's already got conflicting things where some people can be let in because some of those services are essential and some are not. And his main concern was that, one, the burden is falling on staff, but two, that there could be now confrontations or altercations that he feels like his staff shouldn't have to put up with, and that the burden falls on them when it should be maybe not on the city, but on the province or somebody else to take care of.
Well, let's look at that from a practical standpoint for a moment. I mean, that person that told you that is right. I mean, the first step in avoiding that kind of situation from occurring is for people to be non-confrontational about this. I mean, by implication, the people who are going to be causing any of those kinds of contemplated controversies are people who are somehow objecting to having to say they're vaccinated or are objecting to the whole notion that they should be vaccinated. And those are some of the very same people that have been having protests, albeit very small numbers of them. And so I think if people can just act in a common sense and civilized manner and understand the fact that when it comes to something that is in the collective good that the vast majority of people have done, namely to get vaccinated, no one is saying to those people you have to get vaccinated, but the society at large, companies, gyms, the governments, are saying that if you don't get vaccinated, if you make that choice, there are going to be some places where you can't go. And that is in the collective interest of public health. And so I think the responsibility really rests in terms of civilized, decent behavior with the people who choose to make that choice. And nobody's really taking issue. We all wish they would get vaccinated, but nobody's saying you don't have that choice. And so you minimize the controversy that way. I think when you then move on to, well, if it isn't the staff, whose responsibility is it? I think most people will understand it is not possible if we deployed every single police officer, every single bylaw enforcement officer, and we then somehow enlisted, I don't know, firefighters and other people that we could have that, that they don't have the authority. But it is not possible. I mean, I've forgotten now from early days when we were talking about this at the early days of the pandemic. We have thousands of restaurants. We have more restaurants in Toronto than we do first responders. If you assigned every first responder to be there, asking for people's vaccination proof. So, we will do our very best at this, but as I said earlier, I am an optimist that both common sense will prevail with those who have a view about vaccination or a view about vaccination proof that they wish to express. They can do it peacefully. That will not involve confrontation because it shouldn't, it need not, it must not in terms of the kind of civilized behavior we have in Toronto, and that therefore there will be no need for enforcement people, but if they're needed, it will be a very small number of cases relatively speaking, and we can help out in those instances. But I think it'll become very routine for people to show on their way into big or small venues their phone, as we do in so many other areas of life now, and show it. It takes a few seconds, and in you go.
Okay, that's it for today. Thank you, everybody. Have a great rest of your week.